Hypothyroidism is a condition characterized by an underactive thyroid gland, which leads to decreased production of thyroid hormones, primarily thyroxine and 3-iothyronine. These hormones are critical for regulating metabolism, so their deficiency can have widespread effects on the body. Now, hypothyroidism is not a one-size-fits-all condition. It can be divided into 3 types: primary, secondary, and tertiary hypothyroidism. To be able to understand this, we must look at how thyroid hormone production is regulated by the hypothalamic pituitary thyroid axis. In a healthy individual, the hypothalamus secretes thyrotropin-releasing hormone, which signals the anterior part of the pituitary gland, where the thyrotropin cells are located, to release thyroid-stimulating hormone, which then travels with the bloodstream, and when it gets to its receptors on the thyroid gland, it stimulates every step in the follicular cells of the thyroid gland determined for production and secretion of thyroid hormones. Then thyroid hormones are released into the bloodstream, and they travel to various tissues in the body, targeting the cells where they exert their effects, such as increasing basic metabolic rate. Now, what we also have to mention is that when the thyroid gland produces enough thyroid hormones and they finish their work in the body, it sends a message to the pituitary gland and to the hypothalamus to stop releasing their hormones. So high levels of T3 and T4 will decrease the production of TSH and TRH. This process helps preventing excessive hormone production and is called negative feedback mechanism. Now, as we mentioned before, there are 3 types or 3 levels of hypothyroidism. In primary hypothyroidism, the thyroid gland itself is the problem. Here, the thyroid gland itself, for some reason, doesn't make enough thyroid hormones, and it fails to meet the body's needs. There are several reasons that can affect the thyroid gland and lead to decreased production of the thyroid hormones. However, the most common cause of primary hypothyroidism is Hashimoto's thyroiditis, which is an autoimmune condition where the immune system produces autoantibodies, mainly anti-thyroid peroxidase or anti-TPO, and anti-thyroglobulin antibodies, which target and damage thyroid follicular cells, leading to lymphocytic infiltration, fibrosis, and atrophy of the gland. Another major cause is iodine deficiency. Iodine is an essential micronutrient that has a crucial role in the normal functioning of the thyroid gland and the synthesis of the thyroid hormones. So, diminished levels of iodine can lead to hypothyroidism. Then, primary hypothyroidism can also happen after treatment for hyperthyroidism, such as thyroidectomy or surgical removal of the thyroid gland, and radioactive destruction with radioactive iodine therapy. Also, primary hypothyroidism can be caused as the side effect of the usage of some medications such as lithium, amiodarone, and interferon alpha that can interfere with the thyroid hormone production or secretion. Okay, now because of the controlling mechanisms for production and secretion of the thyroid hormones, in primary hypothyroidism, because the thyroid gland is dysfunctional and it produces low levels of thyroid hormones than the body demands, the TSH and the TRH levels will be high. So when we suspect present hypothyroidism, we can check the levels of the hormones, particularly T3, T4, and TSH, and we will have the diagnosis. Okay, so that was the primary hypothyroidism. Now, in secondary hypothyroidism, for some reason, the pituitary gland is dysfunctional, leading to low TSH production and therefore low thyroid hormone production. The most common cause is pituitary tumors, which compress the pituitary gland and prevent the production of TSH hormone. Another causes can be surgery, trauma, or Sheehan syndrome, also known as postpartum pituitary gland necrosis. However, all of these conditions are also accompanied by the lack of production of other pituitary hormones as well, such as ACTH, when it represents another condition called hypopituitarism, meaning, as the name itself says, underactive pituitary gland. And in tertiary hypothyroidism, the low levels of thyroid hormones are caused by the conditions affecting the hypothalamus, such as tumors, brain trauma, and congenital disorders. Because of that, the hypothalamus is dysfunctional, leading to decreased production of TRH, further leading to decreased production of TSH, and therefore of the thyroid hormones. Okay, so those were the causes and types of hypothyroidism. Now, clinically, hypothyroidism can be quite insidious, with symptoms that often develop gradually. Some of the most common signs and symptoms include fatigue and weakness, weight gain despite a normal or reduced appetite, cold intolerance, dry skin and hair loss, constipation, bradycardia, menstrual irregularities in women. And in severe or long-standing cases, you may also see features like myxedema, which is a serious condition marked by swelling of the skin and soft tissues. Now, when we suspect hypothyroidism, as we mentioned before, the diagnostic workup typically begins with lab tests. The key tests include TSH levels, T3 and T4 levels, and anti-thyroid antibodies. An elevated TSH as the indicator of primary hypothyroidism and decreased TSH as the indicator of central or secondary or tertiary hypothyroidism. Then thyroid hormone levels or free T3 and T4 levels, which are typically low, and anti-thyroid antibodies, particularly in suspected Hashimoto's thyroiditis, where we can find high titers of anti-TPO antibodies. Of course, it is always important to correlate these lab values with the patient's clinical presentation and also with imaging techniques such as ultrasonography, CT or MRI, and nuclear medicine techniques. And once the diagnosis is confirmed, treatment is typically straightforward, which is hormone replacement therapy with levothyroxine. And with that, we've come to the end of this lesson. I hope you found this video helpful, and if yes, please make sure to like the video, hit the subscribe button, and comment below with any questions you would like to be answered in future episodes. Thanks for watching.